so that folks have all of the information. If folks were not able to attend from your clinic, they have that information available. And then lastly, Alex is going to go over the assessment process, which I'm going to discuss in the packet if you haven't had the opportunity to go through that yet, and is going to also discuss the collaboration that we have with Expert Effect. And then we'll do the Q&A like I mentioned at the end, so hold on to those questions. Let's go to the next slide. So some participation guidelines. We ask folks while in this space to listen respectfully and attentively. Let's try not to multitask during the time that we're in these sessions, and mute yourselves so that we can all hear the conversation without any distractions. Everybody is a contributor to this learning experience. We're responsible for actively engaging in all discussions. If you have examples and experiences related to that discussion, please share them, even if it didn't have the best results. This is how we learn, how we are going to learn in this space. All questions are good ones, right? Ask questions of each other, no matter how simplistic you think they are. Chances are other folks are probably, having some of the similar experiences or have similar questions. And the goal of the discussion is really to learn and explore together. Maintaining confidentiality is just an effort to create a safe space for everyone to discuss openly some of the workforce challenges in your clinic. And participants are asked to keep information shared confidential, as we may be, discussing, some heavy challenges that may be happening in your clinic. So we want to make sure folks are comfortable with sharing some of that information. Let's go to the next slide. And then I'm gonna start off by doing a CCALAC introductions, or allowing folks to introduce themselves. I already introduced myself, so I'm gonna go ahead and pass it on to Lisa Fisher.
Good afternoon, everyone. My name is Lisa Fisher, and I go with she, her pronouns. I am the Senior Director of Member Services here at CCALAC, and I'm excited for this second round of crew, some changes, and it looks like a great group of folks here. And I'll pass it off to Alex.
Hi, everyone. Welcome. Super excited to have you here. My name is Alex. I'm the Assistant Director of Workforce. And again, I'm excited to have you here. Welcome. And I pass it on to Crystal.
Hi, everyone. Happy Thursday. My name is Crystal Torres. I'm the Member Services Project Coordinator. I go by she, her pronouns as well. And I'm just excited for you all to be here and learn and grow with each other. So thank you. And I'm going to pass it on to Aisha.
Hi, everyone. My name is Aisha. I'm the Admin Associate for our team. I'll be supporting throughout the program, and I look forward to seeing everyone and learning. I'll pass it back to Andres.
Awesome. Thank you all. So this is a team that's going to be supporting all of the trainings throughout, throughout these next few months together. So I'm always your point of contact for any questions or anything that you may need, but there's also, the larger team that's here to support us well in case I'm not available for any reason. Let's go on to the next slide. So we want to hear from you a little bit. Let's do some clinic introductions, and then maybe choosing, I know there's a lot of us and we could, spend the next 40 minutes introducing each other, but, we want to make sure again that we get through all of the information. Let's maybe choose one person from your clinic, introduce yourselves and your team. And I'm going to just go down a list of folks and not in a particular order, and I'll call on your clinic, and whoever would like to speak from your clinic, you can go for it. Let's start off with Westside Family.
Hi, Westside Family Health Center, Culver City. My name's Deb Farmer. I'm the President CEO. And on my team is Marie McKinney, our COO, and Bianca Beltran, our Director of HR.
Great. Thank you, Deb. Welcome.
Thank you.
Okay, let's go with Northeast Valley.
Good morning. Oh, no, sorry. happy lunch. My name is Jose Luis Trejo. I'm the Director of Human Resources for Northeast Valley. And with me, I have my teammates, Jessica Barraza. She's HR corporate trainer, and our engagement labor relations manager, Matt Rinker. Thank you.
Great. Thank you, Jose Luis, and welcome. Let's go with Family Healthcare Center of Greater Los Angeles.
Good afternoon. My name is Yadira Chaides. I'm the Human Resources Manager. And with me, I have David Flores. He's our Assistant HR. And I also have Alex Rodriguez. He is our HR clerk.
Great. Thank you, Yadira. Welcome.
Thank you.
All right, East Valley.
Hi, my name is Manette Canada. I'm the Human Resources Director. And on my team, I have Eric Mona. He is our recruiting supervisor. Raquel Adams is our HR manager. And we also have Henry, and he is our COO.
Great. Thank you so much. Let's go next with Central City.
Hi, my name is Alma Martinez. I'm the Director of Human Resources at Central City. And Dr. Samar Kaskowitz is also on the line, as well as Agapito Medina, who is our benefits person.
Great. Thank you so much, Alma. Let's go with Southern California Medical Center.
Hello, everybody. My name is Kurt Shakovsky, the Human Resources Manager for Southern California Medical Center. Part of our team, our team members will include Tadia Almada, our Human Resources Supervisor, Nicole Mationg, our Quality Assurance Manager, Clinic Managers Carmen Lopez, Kayla Montoya, Charlene Suwarnarat, Evelyn Rodriguez, Diana Carrillo, and our COO, Dr. Ara Bagdasarian, Operations Manager Nancy Mejia. Thank you.
Great. Thank you so much. That's a pretty large team you have. Welcome.
Thank you.
All right. Next, we'll go with Venice Family Clinic.
Hi, my name is Anjali Mahoney. I'm the Chief Medical Officer, and our team is composed of Blanca Andres, who's an Associate Medical Director, Tamara Alonso, who's one of the site managers, and also Yvette Sensores, who's also a site manager.
Great. Thank you. Welcome. Park Tree.
Hi, good afternoon, everyone. My name is Elvia Sanchez. I am the Chief Operations Officer here at Park Tree. And we have a robust team as well, made up of Enrique Melgoza, who's our Chief Dental Officer. We have Kevin Reyes, who is our dental supervisor. We have Courtney Williams, who's our HR manager. Our clinic supervisors, which are Lily Mora and Norma Rios, and then our clinic manager, who is Yesenia Quintanilla.
Great. Thank you and welcome, Elvia.
Thank you.
All right, let's go with Saban.
Hi, my name is Alexa Chande. I'm the Operations Improvement Specialist at Saban. On the call with me is Daphne Torres. She's our wonderful dental manager. And then on our team, we also have Chantal Washington and Stephanie Dyer, both from the HR teams.
Great. Thank you so much, Alexa. Welcome. And last but not least, the LA LGBT Center.
Hello, my name is Abel Tovar, and I am the HR training supervisor here at the center. On the call today, we have Gerald Garth, our director of DEI, and Jocelyn Contreras, our HR coordinator.
All right.
Thank you.
Great. Welcome, everybody. Yeah, so we have a very diverse group in terms of team size and just all the folks that are here and on the different teams of crew. So welcome everybody again, and we're really excited to work with you on this program the next few months. Let's go back to the presentation. So just a little bit of the program overview, and this may be something that you saw on our website in terms of what the program supports with. So CREW will allow member clinics to, clinic teams to learn more of one another while they test and implement organizational strategies to improve workforce well-being and satisfaction. Healthcare teams will learn from their peers. This is going to be through, sharing information, having discussions about the challenges that you're having with recruitment retention in your clinics, and also actively engage in how you're actively engaged in efforts to promote staff well-being and the quality of care as well. Each participating member will receive a one-time payment of $1,000 upon completion of the program, and this is through the participation over the next couple of months in attending all of the different trainings that are available to you all through CREW. Next slide. And then some more specific details. The program consists of didactic training, the once a week trainings that are happening beginning September 8th. Group discussions, individualized coaching, and we're going to go into detail about what the coaching will consist of. And then the teams will implement one intervention with individualized coaching support from Expert Effect. Again, we will go into more detail on that. And then teams will have access up to 5 hours of robust technical assistance facilitated by Expert Effect consultants, as well as in-depth clinic assessment that will happen just to kind of see where you are and what support you may need. Let's go on to the next slide. Here are just the 11 participating clinics. There's been a slight change. One of the clinics could not join us, but hopefully they get to join us in the next cohort. So these are all the folks that are present here and that you're going to be working with in the next few months. Next slide. And I will hand it over to Crystal.
Hi, everyone. Thank you. Sorry, I was just putting the questions on the chat box. So right now, we really want to make folks really engage with one another and connect. So we are going to participate in a small breakout activity. So I know everyone has shared a little bit about their name and who they are on the chat, but we kind of want you guys to discuss it and share your pronouns in your clinic, and also kind of see what intervention your team is interested in addressing. I know Andres sent out the package, and it's okay if you haven't read it. I know things happen, but kind of just talk about like what's something you're kind of interested in learning, and also like what are you doing to combat turnover at the moment, and what successes have you experienced. And again, as we said, we really want folks to engage and participate, and also feel like it's a safe space to kind of speak your own truth when discussing what you're doing now. And yeah, so right now we should get into breakout rooms. If Aisha or someone in our team can create them, and hopefully you guys are able to connect and share with one another what you're looking forward in learning or implementing in your clinic with the interventions. And I believe the rooms are now open. So you have now gotten a message. Please click join. And again, if you have any trouble, please let us know. I feel like everyone's mostly in there. Oh, we should click stop recording. Welcome back, everyone. We're just waiting for more folks to come back. But in the meantime, I hope you guys all had like meaningful conversations. So feel free to like write some highlights of your conversations on the chat or anything that came up.
Hmm. Looks like there was some
For
challenges
me,
with audio. Okay.
Yeah. Only 2 of us out of the whole group was able to, we were able to converse. The rest of the group, we just talked and they couldn't hear us. They weren't responding. So I'm not sure
All right,
if it's
maybe
on their
folks
end or what.
yeah, maybe some folks are having some trouble with audio.
Yeah.
Okay. All right, so it looks like everybody is back. Again, feel free to share, some of the conversations that you had through the chat, any takeaways from that, or focus areas that you'd like to work in. We're going to move on in our presentation, and I'm going to do an overview of the welcome packet. Again, you may have not had the opportunity to check out all of the information on here. It is a lot of information. And so I want to do just a quick overview on the packet in case there are any questions. I want to first acknowledge our funders, ACU, Blue Shield California, the California Endowment, the Area Health Education Center, and LA Care, who have supported our efforts with this retention program.
Do you want me to email it to you?
And make sure that you're muted so that, yeah, there we go. All right, so again, just a quick overview of the packet here. Give me 1 second. There will be 11 clinics participating in the sessions, 7 subject matters experts that are going to be presenting to you all in the next few months. Just a quick overview of the timeline. The first training will begin on September 8th. And then we will have weekly trainings there forward. The majority of the trainings are an hour. There are a few that are about an hour and a half. I've sent out calendar invites to all of the folks that were sent to me in the applications. However, I have had some challenges with bounce backs, and this might just be an IT situation at your clinic where they might not accept certain emails that are coming through. So if you haven't received those, check in with your colleagues. I made the calendar invites accessible to share for folks, so you can share those calendar invites to folks that have not received them for any reason. And then we will end our session. Our closing session is going to be on October 27th, and we're going to give a few months in between for folks to implement some of the information that was shared, or the information that was shared during the trainings, and then also figuring out what things you have worked on. And we're going to come back on December 15th for an intervention sharing, just to see how things are going since taking the trainings. So I went over some of the guiding principles earlier. Actually, there were more of the participation. These are more of the guiding principles. So we understand that healthcare centers workforce is the greatest asset it needs to be cared for and maintained for optimal performance. Patient outcomes are best when the health center staff is free from burnout and are satisfied with their work. So part of the reason that drives this retention work, right, is because we understand that especially during pandemic, workforce within healthcare extremely impacted. Every person in the organization has a role in creating a safe, healthy, and satisfying work environment. Health centers strive to be an employer of choice, meaning that they inspire highly talented workers to join them and stay with them. The drivers of workforce satisfaction and burnout are complex and multidimensional. Right. So understanding, the different changes in trends and what could be happening in these trends in terms of hiring folks is really important for, and also how to retain the employees that do stay there, right? Understanding how all of these things shift, right? As we saw with pandemic and how much that affected the healthcare workforce. Now we have a little bit more of understanding that these things can change at different points in time, and how do we stay informed on how to do best practices. Every healthcare center is different, in a different place in their journey to becoming an employer of choice. So part of the discussions that will take place in this training are going to strengthen different areas that you might need support with, right? So because everybody's on different levels in their progress. Learning and resilient organizations are responsive to changes in the healthcare environment, including, public health crisis, again, going back to all of the shifts and changes that have happened during the pandemic and post the start of the pandemic, and how that's highly impacted all of the clinics in different ways. All right, and then I went over the guidelines of participation in the initial PowerPoint. So again, you will have the opportunity to implement 1 to 2 interventions, and these have been listed out in the welcome packet. You can view the description and details to see if these are areas that you'd like to focus on. The first area is engaged and supportive leadership, and this goes back to implementing, employee recognition programs, providing platforms for folks to identify opportunities for improvement, training supervisors effectively, and what does this all entail? So if this is an area of focus that you'd like to, put your efforts in, this is something to take back to your teams and discuss in detail about which interventions are best for your organization. Diversity, equity, and inclusion. And this is mostly about, your organizational policies, written materials. Do they reflect the culture of DEI? Are making diversity, equity, and inclusion a standing item on staff in leadership and governance meetings? What does this look like for your entire organization across the board, both in internal and external communication as well, and addressing any organizational decision making, and how does that happen within your organization? Are all voices being heard when these decisions are made? Establishing effective formal and informal complaint procedures for folks to express, their concerns around, communication, interactions, all of these different things. So this is what that intervention would focus on. Team cohesion, identifying training needs for staff and support. How is your team working together? What are the gaps that are missing in the team collaborations? Are there platforms that you're not utilizing? Are there ways that your teams can communicate better? So all of these would be covered under the team cohesion. Meaning in work. So this is about focusing on the use of time during supervision meetings to have what matters to you in a conversation, conducting trainings to help staff, management, and leadership understand moral distress, steps that can be taken to support one another. How are folks, communicating with each other on more of a social level, the meaning of the work that you're doing, how are they connecting that work back, to the organization's goals, and things that your organization represents. Positive and safe work culture, establishing standards for trust, respect, inclusion, holding staff and managers accountable for meeting these standards, organizing culturally appropriate social events for staff and families, conducting. So if these are things that you feel are needed or are gaps that are missing within the organization on how to get your staff to be, maybe socialize, in other ways outside of the normal work things, or just fun activities for them to do. Wellness is a big part of the workforce as well. So, aside of, folks hustling on a day-to-day basis, how are they also being recognized? How are they also being, having more of a personal interactions within your organization? Job demands and productivity. Use elevated measurement tools to assess the extent of burnout and the potential contributory factors within the organization. Assessing the workload. Are folks getting balance of work life, right? Are folks getting burned out because of the demand of productivity? How do you balance all of these things? What are some things that you can put in place to support those efforts there? Job demands in terms of workflow and HIT. So this would entail more identifying HIT specific factors associated with burnout by asking staff to nominate anything in the EHR that is poorly designed. So this is more of the technical assistance. If you don't have platforms available, if maybe you need to develop those a little bit more, if you already use specific platforms, what does that look like? Identify ways to increase autonomy, job control, and decision-making using HIT. So there's a lot of room for growth in this area here as well. And lastly, and most importantly, all of the goals that you will set as part of working on these interventions are going to be SMART goals: specific, measurable, attainable, relevant, and timely. And it will give you an opportunity to set a timeline for when you want to implement. And part of that is going to be supported with the coaching that you will receive by Expert Effect. And Alex will talk a little bit about that later on in more detail, so you learn more about it. In this, the last part of the packet is just kind of giving you some information on the folks that are going to be working with you in terms of the trainings. Expert Effect, like I mentioned, is going to be providing some support around the coaching part of CREW. As well as there are a few folks from their team who will be providing trainings in different areas as well. So this is Clark, who oversees or is the head person of Expert Effect. And we have Mary Jean, who's going to be doing one of the trainings as well. Michelle from ACU, who's going to be providing some expertise around wellness, and then April Lewis, Cheryl Peterson, Dick Finnegan, and Matt Bennett. So these are the folks that are going to be joining us for these trainings over the next few months. So feel free to look at the welcome packet and get familiarized with who your trainers are and what their expertise are as well. All right, so I'm going to stop here because Crystal is going to take us into a discussion on Chatter. I'll just mention Chatter is going to be a platform that we use through Salesforce to be able to communicate, and Crystal will give you more of the rundown on how this is all going to work and how you will be connected to Chatter.
Thank you, Andres. Alrighty, so let me share my screen real quick on Chatter. So this morning, I sent everyone to be invited to participate on our Chatter platform. So we really want folks to engage and connect with one another, especially since you are all working on an intervention and maybe some of you are working on similar interventions. So we really want you to share best practices outside from these meetings as well. So this is the CREW Chatter page that you see on my screen right now. I kind of see it as like a hub for folks to ask questions. So you can post anything, and when you post on Chatter, You can also attach attachments and links to it, and even put emojis if you're trying to be fun. So you can post anything on chat, or you can ask questions, and you can have polls as well. So for instance, this morning I put welcome to crew, and I see that I have 3 results so far, asking if we're excited to begin this year. So I'm gonna let more folks participate in that poll that I just input, but it's basically a very fun way for you to connect with people. And we're also using this platform to provide our our materials and our recordings for the sessions, for you to access them, and you will forever keep them. We also have files within our chatter page, where we'll be posting our recordings and again our materials, and you also have access to the crew information from our last cohort as well, if you want to check them out. And again, we really want you to utilize this platform to really engage and talk to folks. Again, you guys are in it together, and we just really want to create that community for you all, and also really just connect with one another. Other than that, do you guys have any questions, comments, concerns? If you do, feel free to connect with me. I'll post my email as well if you have any questions, or if you even have difficulty logging in. I know this platform is new, but it's a platform that we think you would all benefit if you guys really engage using it as well. So with that being said, I'm going to stop sharing my screen and pass it on to Andres.
All right, I'm actually going to pass it to Alex. So Alex is going to give us an overview of the coaching sessions that will happen through Expert Effect and give you all more details about what those will entail. So Alex.
Thank you, Andres. So one of the big components of the crew program is a pre and post assessment. And the reason why we have this assessment is because we want to make sure that, one, you all are learning something through participating in these trainings and discussions, and 2, that we are also making an impact on employee wellness, recruitment, and retention. And those things can only be captured through data. So we are partnering with Expert Effect. They are a consulting firm here in Los Angeles. They work on stress management, stress resiliency, also HR consulting, and they are all about creating high-performing employees. We've worked with them in the past with other projects, and they are amazing. So we're going to be working with Clark, who is the owner of Expert Effect, and a variety of their consultants and HR experts who will serve as the coaches for the program. So the first thing that they're going to do, and they should be reaching out to all of you in the next couple of days, is to schedule 1 hour to do a pre-assessment. And this pre-assessment, they will ask you about 30 to 35 questions. A lot of them are data-driven questions. They will ask you about your clinic size, how many employees you have, number of HR staff you have, number of staff that you have that are responsible for recruiting. They're also going to ask you about employee recruitment in general, in terms of how long does it typically take to recruit an individual, what are some of the positions that are hardest to recruit and why. There's also questions about employee engagement and retention, and some of your retention rates. There's also going to be a few questions about employee wellness, and what you're currently doing to improve employee wellness. And then there will be also some questions on justice, equity, diversity, and inclusion, JEDI, so that we can understand what's some work that you all are doing around that. So that would be the pre-assessment. At the end of the program, which will actually be sometime in January of next year, there will be a post-assessment, which again, you would meet with the Expert Effect consultants to answer those questions, and so that we can understand what are some of the skills that you've learned, what are some of the interventions you've implemented, and what are some of the changes that you are starting to see in regards to recruitment and retention. As part of the program, there is a total of 5 total hours that you get from Expert Effect. 2 of those are used for the pre and post assessment. So you will get 3 hours of coaching with Expert Effect consultants. So after you've met with them to do the pre-assessment, you might identify some challenges that came out of that assessment. Just for example, you might say, hey, we need to work on our employee manual. So you might spend an hour of your coaching sessions meeting with the HR consultant, going over your employee manual and looking for ways to make it more employee friendly. That might be a way that you might utilize one of your hours. Another way would be for you to utilize an hour to create some trainings for your staff. So you might work with a consultant to develop some trainings on resiliency or mental health or those sorts of things. We do know that some clinics might not utilize all of their 3 hours. So if there are any hours left towards the end of the program, we might disperse those to other clinics so that they might have more hours to utilize with these consultants. Also, remember that you do get $1,000 at the end of the program. So you can also use those $1,000 to purchase additional consulting hours with Expert Effect. They are giving us a reduced rate, and I'm sure they will pass that on to you so you can continue working with Expert Effect for those coaching hours. And right now we do anticipate for the coaching hours to be somewhere at the beginning, the middle, and the end of the program, just so that they're kind of spread out and we don't overwhelm you all with all that. Any questions on the coaching Expert Effect or on the assessment? And you should receive an invite from someone named MJ from Expert Effect, who will reach out via Calendly to send out to schedule that with you all.
Yes, Alex, I have a question. This is Jose Luis Trejo. Can we use their materials to apply those materials in our organization? Do we have the copyrights to use their materials?
To use Expert Effects materials?
Yeah.
Definitely. I think that's a question more for them and depending on what materials they provide you. But if they're providing you the materials, I'm pretty sure that means they are allowing you to use them. But we can definitely take that question back to them and get 100% clarity on that. But I'm going to say pretty sure yes.
Thank you.
If there are any other questions, you can also type them in the chat box. If not, I will pass it back to Andres.
All right. Thank you, Alex. I see something came through.
Oh, there is one question in the chat box. It's one assessment per clinic.
Yeah, and it's one pre-assessment and one post-assessment. So it's a total of 2.
Correct.
Yeah. All right, so we roughly have about 4 minutes or so. I want to be respectful of your time. So I want to open up for any general questions that came up for you during the presentation. And again, feel free to type it in the chat or feel free to unmute yourself and ask your question. Okay.
Andres, I put in the chat, this is Jose Luis Trejo again, that when you create the rooms, make sure that you split my team, our team, the Northeast Valley, because we in this room, we ended up 2 out of the 4 from Northeast Valley. So if we split, that would be very good.
Would that be for all future trainings?
Everything, yes.
Okay. All right, we'll make sure that we do that next time. Thank you for letting us know. All right, great. Okay, if there are no other questions, if anything comes up after, feel free to send those questions. If it's about Chatter, to Crystal, any other general questions to me, I'm happy to answer any of that. Again, the first training will take place on September 8th. And then we will have weekly trainings thereafter through October. And then we will take that break for you all to, work on the implementation of these things and then come back for a share out in December. So I'm going to be sending out an email just as a reminder of the trainings. Again, I experienced a lot of bounce back, so I want to make sure that everybody has the information. I'll add the link directly into the link for Zoom directly into that email. So that way, if folks didn't receive the invites, you still have access to that information. But if there is nothing else, thank you all for, there's another question in the chat from Alexa. Is there a calendar with the timeline benchmark events on Chatter? Is that something that can be done on Chatter, Crystal?
Unfortunately, there isn't a calendar, but what I can do, I can post all Zoom links of future trainings on Chatter as well if you have trouble getting those calendar invites, just so folks can reference that. And again, all like follow-up correspondences will be on Chatter, and we'll also share resources there. But I also encourage you all to share your own resources, because you guys might have resources that are beneficial for the whole cohort as well.
Yeah.
So I'll do that.
Can I also add to something really quick? I know we walked through a lot of information today, just probably trying to figure out what this is going to look like. Seeing that question is just, I guess if you think about, you're going to select an intervention or two from that list that Andres shared with you. And it could be something beyond that list, but we're really creating those offerings. And then all these trainings and the support is to help you build and implement that intervention so that everyone's kind of on their own journey, but that those resources are here. So I just kind of wanted to say that all together, because we've said a lot of different things. It's really about helping you implement some changes, some interventions, and we're here to support you. Thank you.
All right, anything else from the team? Alex, Crystal? Okay. All right, great. Well, thank you so much, everyone. Again, I look forward to working with you all through this program, and have a great rest of your afternoon. We will see you back on September 8th. Take care.
Bye, everyone. Thank you.
Thank you.